The innermost part of the bronchial apparatus are the bronchial pouches. What does the first bronchial cleft derivatives into? External auditory meatus. What is the bronchial cleft which derives into the external auditory meatus? First bronchial cleft. Which bronchial clefts develop into the temporary cervical sinuses? Second through fourth bronchial clefts. What obliterates the temporary cervical sinuses? The proliferation of second arch mesenchyme. What is obliterated by the proliferation of the second arch mesenchyme? Temporary cervical sinuses. Failure to obliterate the temporary cervical sinuses lead into underscore bronchial cleft cyst. Location of bronchial cleft cyst. Lateral neck, anterior to the sternocleidomastoid muscle. What is the MCC of bronchial cleft cyst? Persistent cervical sinus. Is a bronchial cleft cyst, lateral or midline, of the neck? Lateral neck. Maxillary and mandibular processes are cartilage, bone derivations of which bronchial arch? First bronchial arch. What are the muscles of mastication? Temporalis, masseter, lateral and medial pterygoids. Muscles of mastication are derivatives of the first bronchial arch. Which ear muscle is a derivative of first bronchial arch? Tensor tympani. What bronchial arch gives rise to the anterior 2/3 of the tongue? First bronchial arch. Which nerve is derived from the first bronchial arch? CNV3. Meckel cartilage is a derivative of the underscore bronchial arch. First bronchial arch. What are abnormalities associated with the first and second bronchial arches? 1. Pierre-Robin sequence. 2. Treacher-Collins syndrome. Pierre-Robin sequence is an abnormality or pathology of the underscore arches. First and second bronchial arches. What is Pierre-Robin sequence features? Micronathia, glossoptosis, cleft palate, and airway obstruction. What is the cause of Treacher-Collins syndrome? Neural crest dysfunction. What are the main physical features of Treacher-Collins syndrome? Mandibular hypoplasia and facial abnormalities. Cartilage derived from the second bronchial arch. Reichert cartilage. What is included as part of the Reichert cartilage? Stapes, styloid process, the lesser horn of hyoid, and stylohyoid ligament. Which bones arise from the second bronchial arch? Staples, styloid process, and the lesser horn of hyoid. Stapes is a derivative of the underscore arch. Second bronchial arch. The muscle of facial expression are derived from which bronchial arch? Second bronchial arch. Posterior belly of digastric is derived from the underscore. Second bronchial arch. Which nerve is a derivative of the second bronchial arch? CN7. Which is the cartilage derivative of the third bronchial arch? Greater horn of hyoid. Muscle derived from the third bronchial arch. Stylopharyngeus. CNX is a derivative of the third bronchial arch. Associated cartilage, bone derivatives of 4th, 6th bronchial arches. Arytenoids, cricoid, corniculate, cuneiform thyroid. 4th bronchial arch muscles. Most pharyngeal constrictors. Cricothyroid. Levator veli palatini. The cricothyroid is a derivative of which bronchial arch? 4th bronchial arch. Which is the only intrinsic muscle of the larynx derived from the 4th bronchial arch? Cricothyroid muscle. What muscles are derivatives of the 6th bronchial arch? All intrinsic muscles of the larynx except the cricothyroid. Which CN innervate and is derived from both the 4th and 6th bronchial arches? CNX. What part of CNX is derived from the 4th bronchial arch? Superior laryngeal branch. The superior laryngeal branch of CNX is the derivation of which bronchial arch? 4th bronchial arch. The recurrent and inferior laryngeal branches of CNX are derived from the 6th bronchial arch. Which parts of CNX are derived from the 6th bronchial arch? Recurrent and inferior laryngeal branches. Which bronchial arch, S, form the posterior 1/3 of the tongue? 3 and 4 bronchial arches. Main derivatives of the first bronchial pouch. Middle ear cavity, eustachian tube, and mastoid air cells. What is an important contribution of the first bronchial pouch? Endoderm-lined structures of the ear. What are the derivatives of the second bronchial pouch? The epithelial lining of palatine tonsil. What is the anatomical relation between third pouch and fourth pouch structures? Third pouch structures end up below fourth pouch structures. Two main derivatives of the third bronchial pouch. 1. Dorsal wings to inferior parathyroids. 2. Ventral wings to thymus. Which bronchial pouch gives rise to the inferior parathyroids? Third bronchial pouch. The thymus a derivative of the underscore, bronchial underscore. Third bronchial pouch. What is the structure formed by the ventral wings of the third bronchial pouch? Thymus. The structure formed by the dorsal wings of the third bronchial pouch. Inferior parathyroids. Superior parathyroids are a derivative of which bronchial pouch? Fourth bronchial pouch. What are the structures formed by the ventral wings of the fourth bronchial pouch? Ultimobranchial body to parafollicular, C, cells of the thyroid. The parafollicular C cells of the thyroid are a derivative of the underscore. Fourth bronchial pouch. The most common cause of DIGEORGE syndrome. Chromosome 22q11 deletion. What pathology is due to the aberrant development of third and fourth pouches? DIGEORGE syndrome. What is the type of cardiac defects associated with DIGEORGE syndrome? Conotruncal abnormalities. DIGEORGE syndrome is seen with underscore Ca2 plus serum level. Hypocalcemia. Hypo or hypercalcemia is seen in DIGEORGE syndrome. Hypocalcemia. What is the cause of cleft lip? Failure of fusion of the maxillary and merged medial nasal processes. The failure of the maxillary and medial nasal processes. DX. Cleft lip. Failure of fusion of the two lateral palatine shelves or failure of fusion of lateral palatine shelves with the nasal septum and/or median palatine shelf. Cleft palate. Defect in formation of the secondary palate. DX. Cleft palate. Defect in formation of the primary palate. DX. Cleft lip. What is the default genital development? Female.